Good morning, everybody. Good morning. I'd like to call this special meeting of the Wilson County Board of Education to order. Members of the board, I will need the approval for the agenda.
Madam Chair,
Mrs. Powell,
I move that we approve the agenda for the special meeting on January the 19th, 2020 of the Wilson County Board of Education.
Second.
it has been moved by Mrs. Powell, seconded by Mr. Mercer, that we approve the agenda for the special meeting of Tuesday, January 19th, 2021. Is there any discussion? Hearing none, please record your vote. Mrs. Barnes?
Aye.
Mr. Boykin?
Aye.
Mrs. Boyette?
Aye.
Mr. Breen?
Aye.
Mr. Mercer?
Aye.
Mrs. Powell?
Aye.
Myself, Dr. Fitch, aye. Let the record reflect that the motion carries unanimously. Please know that this meeting is being held remotely through the Zoom video conferencing platform, and the following board members are present in the boardroom: Mrs. Boyette, Mr. Boykin, myself, Dr. Fitch. The other members, Mrs. Barnes, Mr. Mercer, Mr. Breen, and Mrs. Powell, are remote. And the meeting is being televised on Spectrum and Greenlight Channel 22 and live streamed through the Wilson County Schools YouTube channel. The public can also view the meeting through the links on the Wilson County Schools Facebook, Instagram, and Twitter pages and the Wilson County Schools website. Based on the executive orders from the governor, face coverings must be worn during the board meeting. We also have present in the boardroom Associate Superintendent Dr. Wilson, Assistant Superintendent Dr. Williams, Administrative Clerk Mrs. Horrison, Board Attorney Mr. McPherson, and from the Wilson Times reporter Drew Wilson. Thank you. Please join me in the Pledge of Allegiance, to be followed by a moment of silence. I pledge allegiance to the flag
To the
of the
flag
United
of
States
the United States of America,
to the republic for
to
which it stands,
which it stands,
under God,
one nation,
indivisible,
under
with
God,
liberty and justice for
indivisible,
all.
liberty and justice for all.
Thank you very much. Members of the board, we have one agenda item to deal with today, and it is the revisiting of the second semester transition plan. I'm going to turn it over to Dr. Wilson, to Dr. Mills, who is remote today. But Dr. Mills, we'll turn it over to you for your lead-in. Thank you very much.
Yes. Thank you, Madam Chair. We're going to share the presentation now, so everyone can see. Bring that up. Okay. Today, what we wanted to share was just a few things to give you an update on where we are for this semester. Cheryl, if you'll go to the next slide. Really what we had planned to do when we talked earlier about returning, we're under the plan right now to have students return on Monday the 25th. Teachers returned today after the holiday yesterday. And one of the things we talked about was taking a look at where we were and having a chance to share information with the board, as well as the trends and patterns that we've seen. So for today, we wanted to talk a little bit about the number of cases and contacts that are increasing here in Wilson. We've got the health department staff with us to share information. We want to talk a little bit about the patterns of cases and contacts before the break that caused some limitations for us for the operation of our schools. And then we want to share some current related concerns with the board as we talk about plans for this semester. In the meantime, again, we're scheduled to begin Plan A again for elementary and Plan B for middle school. That was what we had been doing before the break. And then high schools are supposed to be coming back on Monday for 1 day a week as we rotate through. So that was the plan. So we just wanted to bring you up to date on some things, share concerns, and go through the data as it is now. So the first part of the presentation, we've asked Teresa Ellen, Director of the Health Department, Angie Manning, who is Environmental Health Supervisor, and Dr. Kim Almquist, who is our WASH Center guru, to share some feedback from what they're seeing as about the positivity rate as well as the vaccine distribution. So I'll turn it over to Ms. Ellen.
Good morning. Can you hear me?
Good morning, Ms. Ellen. Yes,
Yes.
we
I can hear you.
So I'm coming to you from the hallway of Fike High School as we are doing a large drive-through event today, and we are more than on pace. We had planned to give 1,170 vaccines, but I think we're going to end up giving more like 1,800 before the day is out. So things are going quite well here. Unfortunately, we are still in a period of widespread community infection with the coronavirus. We're having 70 to 90 cases a day. We're well over 6,000 cases total. And I'm sorry, y'all, I'm having trouble thinking because my mind's going 90 miles a minute from the day's events. What am I forgetting? Angie's here with me. But we are hopeful that we will be getting more vaccine in arms. Our teachers should come on board probably around March. They are in the next group. They keep changing the groups up on us at a moment's notice. And just last week, they changed the over 75 to over 65. And then the next group past that will be essential workers, and that's where our teachers will fall. It starts with 50 and over, and then from that group, it moves to all teachers. We plan to be able to vaccinate all of your staff with our WASH staff and some additional employees. So we feel like we can get that taken care of, and hopefully utilizing your school nurses and maybe some student nurses as well. And I'm happy to answer any additional questions you might have.
Well,
Teresa, can you share the positivity rate that we're
Yes.
at now?
It is 12.9%.
And before break, what we were looking at was around what?
Oh, it was 14.5% at that point.
Okay, so it's been ranging 12 to 15%?
Yes, that's correct.
Okay.
Well, first of all, Ms. Ellen, let me thank you and the health department staff, the Duke Life Point Hospital, the Community Health Center, the police department, the sheriff's department, emergency management, and all of your staff and everybody involved with getting this mass vaccination effort going today. We're happy to have partnered with you in providing the parking lot access at Fike. I had an opportunity to ride by this morning. It seemed to be a well-oiled machine. The people were in line. Everything was looking good. I did not go on Harrison Drive. I only rode around the outskirts on Ward Boulevard, circling, and everything seemed to be running smoothly. So we thank you. It's nice to know that you planning or actually have more vaccines than had been announced to the public, and it seems like everybody is turning out. So we hope that you can get all of those shots in the arms. We are also hoping that as things change, that our teachers will be given a quicker opportunity to have a chance at their vaccinations. We're thankful that WASH will be available, so that hopefully that will cut down on the long lines. And since we have 2 WASH sites, then hopefully that will go well. So we thank you for all of the cooperation. We know that those positivity rates are not good. We have had a lot of concern expressed from parents as well as teachers about the possibility of our return. And we do know that we had indicated that even though our plan was to have everybody back in school under the various plans on the 25th, which is this coming Monday, and that's why we're here today, because we said that we would reevaluate and see where we were. So we are now at that point of looking to see what's going to happen and what the recommendations will be from the administration. So I'm going to end my comments. I'm going to turn it back over to Dr. Mills. And again, thank you, Ms. Ellen, for all the work that you do to help Wilson County Schools and the community. Dr.
Madam Chair.
Mills? Mr. Boykin?
I've got a question for Ms. Ellen.
All right. Ms.
Have-
Ellen, can you hear Mr. Boykin?
I can, thank you.
All right.
Have you recorded any instances of child to teacher or child to staff transmissions in Wilson County schools?
Hold on just a second, I'm gonna let Angie Manning answer that, because she's been working closely with Dr. Williams, any staff to child transmission.
So just so I'm clear, your question is, have there been any transmission from staff to child transmission
As
in
well.
Wilson County Schools, correct?
I think he also asked child to staff transmissions
Child
as
to
well.
staff, correct.
Yes, sir, there has. It appears to be, yes, sir.
Do you know how many cases?
Right off the top of my head, sir, it appears to be possibly, this is right off the top of my head, possibly one of each. It's less than probably, it's less than a total of 5 cases between the 2 scenarios that you gave.
So just to be clear, that's 5 altogether and not 5 of each.
Correct, yes, sir, yes,
All
sir.
right. Thank you.
Out of all the cases of Wilson County, yes, it is a very, very low, extremely low percentage, yes, sir.
Well, that's very promising.
That I'm able to actually possibly epi-link in, correct.
Very promising. Thank you.
Madam Chair, I have a follow-up question to that question.
Mr. Breen?
Does that include all of, we said children, but is that public and private school children, or is that just Wilson County schools?
That would just be, to answer his question, that would just be involving Wilson County schools. That could be epi-linked to known cases of involving spread from known cases of either staff or child-related cases.
I have a question. So just to kind of piggyback off of that is, so the number of cases in the very beginning was 0, and now after the holidays is 5 that we know of?
Yes, some of those cases occurred prior to the holidays.
Okay. Because I know that was a big issue with the holidays coming up.
Right, and we have seen a surge in overall cases since Thanksgiving.
Now, my answer is not.
And we have no way of knowing unreported or very mild cases if they have not sought medical attention, correct?
Could you repeat that question?
Okay, and that's the known cases, because I'm sure that have been, with people being asymptomatic, that there may possibly have been COVID cases that we don't know of because of the mild nature that some of the cases may present. And
That is correct, because we're not always able to trace exactly where someone contracted the virus.
All right, are there other questions at this point?
Madam Chair, I'd like to ask one more.
Mr. Boykin?
In a recent study that's come out with UNC and Duke, of about 90,000 students and staff in North Carolina, one of the excerpts out of the study said that there was no medical reason to stay out of Plan B. Can you give us your thoughts on that?
So the issue is not so much the cases in the children, because they often are asymptomatic. The issue becomes your teachers and having enough staff to teach, because we have had a large number of teachers and staff that have been positive.
So would that confirm that there's no medical reason to stay out? It would be more of an administrative reason?
Well, certainly if you have staff working who are infected with the virus, they can pass it on to both students and other staff.
All right, thank you.
Are there other questions? All right, Dr. Mills, if you want to continue.
Yes, Madam Chair. Go ahead. Dr. Williams is going to share some information from our dashboard from just the school system. But I want to point out a couple of things as he's getting started. As Ms. Ellen was sharing, and we put this in there to kind of reiterate the impact for us is not so much the cases. And Mr. Boykin was asking about the medical piece, and I think that's something everyone's been looking at and talking about, and the studies are out there. But for us, the real impact has been for the contacts and the disproportionate impact that they have on our operations. And while the numbers capture cases and contacts to a degree, I mean, the numbers are the numbers. The problem we ran into, and we'll share some more information in a little bit, is the effect they have cumulatively and individually on our ability to have classes and to have school function as it needs to. And that's what we were seeing before break with classrooms and schools having to go into closure when our percentage was a little bit less than it is now, as it's vacillated between 12 and 15%. And we've seen those numbers go up after holidays and after get-togethers and those times. So that's something I wanted to point out when Dr. Williams was sharing these cases. There's some logic in it that's just not number-based. So I just wanted to frame some things with that as we get started. So Dr. Williams, if you'll walk everyone through some of this information.
Yes, sir. Thank you. Madam Chair, members of the board, just want to share a little bit of information in regards to our Wilson County schools data and some of the information from second quarter. Madam Chair, if it's okay, I know our health department staff, they have the vaccination clinic going on. Can they be dismissed at this time to return back to that, or would there be some follow-up questions that we need to keep them on for?
Members of the board, do you think you have any further questions for Ms. Ellen and staff while they are still with us online?
I don't have any.
I don't.
No. Yes, thank you, Ms. Ellen, and the rest of your staff, and we're going to let you get back to your vaccination drive-through, and we thank you so very much for all that you do to help Wilson County as a whole.
Thank you, Madam Chair, and we want to thank Wilson County Schools for allowing us to use Pike High School as our venue, and always being a wonderful partner.
All right, have a wonderful day. Thank you.
Madam Chair, just and members of the board, just want to share a little bit of data from our Wilson County Schools dashboard. There were 33 reported positive cases since Christmas, the 25th of December, 2020. These are just a couple of things on the reported cases. So these, while we were on break and on remote, that's why I said reported cases, because when we were not in buildings, they may not have all been reported. But we had 33 reported cases. As of yesterday, the total number of staff that were quarantined or self-isolated was 26. There were 17 active cases, and there's 9 active contacts at this time for Wilson County Schools specifically. And these cases and contacts have had less of an impact, obviously, on our schools, like I mentioned before, because we're remote. So we haven't had numbers of student contacts or additional contacts off of these positive cases because we're in a remote setting. As Dr. Mills had mentioned, the issue does not come into play in terms of rather contacts, but excuse me, it's the issue that we face in schools is the number of contacts and the impact that has on school operations. So, for example, if we have a positive case in the school, that can lead obviously to a certain number of contacts within inside that building, which could mean that if there are not enough adults in to be able to operate the school, then the school has to go on remote. That can also be the case for classrooms. If we have a positive case inside of a classroom, then that classroom is quarantined, and that class, sometimes grade level, is placed on remote. We've got some information from second quarter to share about that in regards to those closures, or going into remote rather, excuse me. Because of the growing number of cases that we have had in Wilson County now, that will lead to some difficulties in regards to large numbers of contacts. So that there's a possibility, obviously, for staffing issues whenever you have large numbers of contacts. If we can click on that link for second quarter, this was some information that we shared at the end of second quarter. And I'm not going to go back over it again. I know we did this, at the board meeting whenever we met. But these were some scenarios that we were running into at that time whenever we had the meeting and went into a remote setting for the end of the second quarter and extending, moving into the third quarter, which were school closures, classroom closures. We had school nutrition staffs that were out, meaning that we had some cafeterias that were closed at that time. And I'll go over some of those numbers specifically in just a second. The impact of cases and contacts outside of the school system, they're not reflected on our dashboard. So I just wanted to make note of that when you see contacts and you see positive cases, those are specific to Wilson County Schools. So a positive case in Wilson County Schools is identified on the dashboard, and any contacts from that positive case in our school system is identified on the dashboard. So that would not include any additional cases in which someone is a contact outside of the school system. So if they become a contact at another event or just in their day-to-day lives, it's reflected on each school's tracker that they use to keep up with their staff, but it's not reflected on what we have in our dashboard. So those numbers obviously there are more of those because as we show what we have in Wilson County Schools on our dashboard, you still have those who have become contacts outside of school, and that's reflected inside of the trackers at each individual school. It's not reflected on a dashboard for the district. So that's just to sort of bring some things back in terms of what we're seeing on our dashboard and what we actually have. In conversation with our principals last week, they had indicated that they believe that extending in remote was would be a good idea in regards to current trends. They're the ones that we do our contact tracing with, every time we have a positive case. So if we have a positive case in the schools, principal calls me, and then I contact the health department, and then we go through the contact tracing process. So, this is who we've gone through those contact tracings with. If we go to the next slide. And this is some information from the second quarter. So we re-entered on October the 22nd. And from October the 22nd until we were remote again, just at the end of second quarter, this is the number of classrooms that went on remote, the number of cafeterias specifically that we had on remote, and the number of schools that the entire school went remote at some point in time during that second quarter. Now, I would tell you that the vast majority of, specifically the schools that had to go remote, that was after Thanksgiving, that we started really moving towards remote situations for those schools after Thanksgiving. And, as we shared on our previous data from the second quarter, we had, exponentially higher cases after Thanksgiving leading up to the end of second quarter. So that is reflective of that information. And we did have one whole department that ended up having to be remote for a period of time in quarantine also. And that is all of my information in regards to second semester data and any current data that we have. Excuse me, second quarter data. Apologize.
All right, does it go back to Dr. Mills?
Madam Chair, board members, we also took a second to get the information for what other districts were planning to do as it stands right now, so you would have that information as part of the presentation. There's about 9 or 10 there. Some are remote until fourth quarter, some are coming back as our schedule. Some have come back and have gone back to remote. I think that was Pitt, and others are coming back in various formats already after the break. So in those changes is only as good as the information we could find at the time it was printed. So just wanted you to have that as reference because that comes up a lot as people stop and ask questions. Dr. Parker can talk a little bit about substitutes and where we are with that.
Yes, sir. Madam Chair, members of the board, as you know, substitute teachers are a vital part of providing educational quality and consistency, and that's even under normal circumstances. Now, when you factor in the issues concerning COVID-19, that's magnified. And as you know, some months ago, the board had the foresight to prepare subs by requiring them to do training modules that would help them be better prepared to provide these services in a remote learning environment. The 5 modules were safety environments, remote guidance, and 3 remote learning tools, Google Meet, Google Classroom, and Seesaw. In the beginning, we contacted a total of 124 substitutes. Out of that 124, 104 replied. Out of that 104, 86 replied yes, they will be available, and 18 replied no. Now, out of that 86 who replied yes, as of today, 68 of those 86 have completed the modules, as I described before. However, that takes us to kind of a quandary that we're running into. Several principals, bookkeepers, secretaries, et cetera, have expressed concerns that the subs in this available list of 68 have not felt comfortable serving as substitutes during this time while we're dealing with COVID. And looking at the data, going from October 22nd, when students returned, up until a few days ago, we had 554 subs requested. 460 of those subs were filled for a percentage of 83%. Keeping in mind during normal circumstances, that number is usually in the mid-90s. 94 of those subs went unfulfilled. And to try to give you just a picture of what actually happens, the raw data that creates the 83% number doesn't include subs filled by teacher assistants when available, and when teachers help fill these sub requests by splitting classes in order to try to cover substitute requests.
So did you say that 68 of the 124 who had been sent information, 68 completed all 5 of your modules?
That's correct.
But how many of those were actually available?
Well, they all are available. Now, when contacted in our interviews with principals, secretaries, bookkeepers, et cetera, there have been several instances where of this 68, they would not report. They did not feel comfortable with reporting, even though they've completed the modules.
Okay. Would that be at least half or a quarter, or any idea as to how many of those 68 did not report?
It's a little tough to tell because different schools have different subs that they kind of depend on.
Okay.
So it's the only data that we have is in ASOP, which is the first 3 columns in this slide. So just trying to give you a caveat that even though we have this 83% number, which is significantly lower than normal, even that is pretty much bolstered by the fact that teachers and teacher assistants have helped cover in many instances.
Thank you. Do you have any other questions?
Madam Chair,
Mrs. Boyette?
last week, Dr. Parker sent out a notice that the Families First Coronavirus Response Act, which provided 80 hours of sick leave for quarantine due to COVID-19, was not extended past December the 31st. So my question here is, you said that they had, if they had a medically documented COVID-19 positive case or exposure after January 1, they had to use leave balances as directed by the attached board policy 7510, unless the county health director orders you to leave the work environment under the state contagious disease leave policy. So
That's
my
correct.
question is, I understand that it was not extended past December the 31st, that you had up to 80 hours of sick leave. But I've read the board policy. Doesn't the county health director tell staff that they can't go to school if they have COVID? So explain to me why that wouldn't allow them to use, if she tells them that they had to stay at home and they don't have leave, what happens?
Okay. So Dr. Williams and I, and specifically Dr. Williams, has been working closely with the health department on this matter. Just like before, pre-December 31st, if someone has a diagnosed case of COVID or is quarantined and that is documented by the health department or medical provider, they provide us with that documentation, and then we would enact COVID leave. That process hasn't changed. Since putting out that, in the same time of putting that out, the county health department director has provided us with a letter that through Dr. Williams, when someone provides that documentation, then we would enact contagious disease leave, because we were looking for other avenues to prevent people from having to take their leave balances per 7510.
Does that then mean, though, that we were receiving CARES money to pay for that leave before December 31st? And do we receive any money to pay for the subs that we have to pay now?
I'm not certain about the funding under the FFCRA. As far as the 24 leave, the contagious disease leave, that has always been in our system. From what our attorneys have shared with me, it is funded just like subs were before, depending on the funding source of the teacher. So if it's federal, if it's Title I teacher, it's a federal source. If it's an O1 teacher, it's a state source. The funding mechanism works pretty much the same, from what I've been told.
Ms. Boyette, if I may. Good morning, Board.
Good morning.
I have had the opportunity to work closely with DPI on this particular issue for the past 3 months because we saw this coming, frankly, because Congress was so indecisive about what they were going to do with AFFCRA leave. I want to cover a couple of what I consider very pertinent points. The first of which is the FFCRA leave was funded through both the FFCRA and the CARES Act. So there was a federal pipeline of funds that went to the state agency that then made its way down to local governments to fund that particular portion of leave. And sort of the more important aspect of that, I would say, is the, in addition to your emergency paid sick leave, which was 80 hours, the additional emergency FMLA sort of provided this cushion for parents in the event that they had to stay home with a child because of a school closure, which in certain instances has been happening more often than not. In that quest to find something to fill that space, Contagious Disease Leave Act has become this, until otherwise, provided, the best remedy we have. And contagious disease leave is sort of acting as, with the help of your health department, a notice to the employee to leave the environment. It's sort of like a form letter that is given to an employee when maybe the school nurse or someone else is contacting them to say, hey, by the way, you are a contact. And it provides them with what they need and what human resources needs to categorize this, to put it into a fully funded area. Now, the other piece about contagious disease leave is that the employee is not charged for a substitute. Now, that substitute is paid by the source, the same source of which the employee is paid, as Dr. Parker said. But furthermore, the funds that will not be deducted from the employee's paycheck, and nor will their leave balances be impacted. And I think those are the two very important things to think about whenever the contagious disease leave is in play, which most certainly will be most of your cases. Additionally, contagious disease leave does not have an end date. So whereas FFCRA leave, you had 80 hours and then you had an additional 10 weeks if for some reason you were a parent who had to stay home with a student or a child. In this instance, contagious disease leave can take you out for quite a while, depending on the circumstance. And it can take you a pretty good ways without impacting employee sick balances. As far as the funding goes, there have been discussions of what the new Congress and President plan to do as far as FFCRA Act or other potential impacts that may have. At this time is a little too early. I anticipate something coming as far as federal funding to step into this gap. The last thing I'll say is that FFCRA, Congress in their most recent act had a locally funded option. So FFCRA was originally two types of leave that were provided. emergency paid sick leave, and the emergency FMLA leave, which you were required as a government employer to have. Like, you had to offer those. There was no option. What has been done is Congress has now said that, okay, you can do either one of these things, but you've got to pay for it yourself. And the paying for it yourself is essentially, biting off a burrito that you don't know the size of, is the best way that I've seen it described. But in any event, I feel like that's something the board needed to know. The question was raised. If there are additional questions, I'm happy to answer them.
Can I just ask a simple question, because I'm a simple fellow?
Yes, sir.
Mr. Breen?
Employees on contagious leave or quarantine leave or whatever the contagious leave is, do they still get paid?
Yes, sir. Full pay.
Oh, all right.
Yes.
That's all I needed to know.
Yes, sir. Thank you for the question.
Will that penalize their vacation or sick
No.
leave?
No, sir.
No, it doesn't affect any of their leave balances or their pay.
So let me just add that the good news is that I've just learned is that our employees are covered
Yes, ma'am.
through this. The bad news is our substitute cost per year always
going.
exceed what we receive to cover them.
Yes,
So that means that we are going to be in debt for the subs. So that's the bad side of it. And
Yes, ma'am.
the other side, I am thrilled that our employees are covered. However, many of the parents that are having to stay at home and care for their K-5 students do not have this same coverage or are in fact losing jobs and wages because the children are not in school. So I'm thrilled that we're covering our employees because we are able to, but many people don't have that opportunity. Thank you.
All right. Dr.
Dr.
Mills?
Parker?
I'm
Yes,
sorry,
ma'am.
Mrs. Powell.
Thank you. You said earlier that there's a certain percentage of splitting classes. I have two questions. What was that percentage? And could you explain the process of splitting classes and how that affects the instruction in the classroom with the teachers in there? Because I know that they're only allowed a certain number with the social distancing.
Correct. I don't have a specific percentage of principals who decided to split classes. That was done on an as-needed basis. From what I understand, and like I said, we've had informal discussions with principals, bookkeepers, and secretaries about how they've had to handle, these things on an individual basis. So, if a teacher called in, if they had a teacher assistant, they would get it covered that way. If there was no teacher assistant available, then they have to split the class. But there's no data there to suggest that there's a certain percentage or times when they did so.
Because I know as a former teacher that whenever I had to have extra students in my classroom, it changed the dynamics of the whole classroom,
It does.
depending on the behaviors and, what they're actually, supposed to be taught.
Yeah.
Because sometimes you have students that are at a higher level than other students. And the teacher is therefore, has that ability to address those needs, but it can be very difficult at times.
Yes, it is an additional burden on staff every time a sub is not available to come into the building and take on that responsibility.
Dr. Wilson has some comments to make.
Ms. Powell, I do not have any numbers to give you, but I do have some examples of some principals who had had to do that and split some classes.
Can you talk a little bit louder, Dr. Wilson? I'm sorry.
Is that a little bit better?
Yes.
Okay.
Yes.
I do not have any numbers, but I do have some examples of how that was done. Is that
Okay.
at the middle school level where the numbers were low because we had split it in a green group and a blue group, we would have very low numbers already in a classroom that was lower than the number that would have been for social distancing under Plan B. And so they could have put two classes together, and while it might sound like two classes, it might be 6 kids from one class because they came on face-to-face, and then 10 kids from another, and then that number is still well below the social distancing number that's required for Plan B. Another example of that would be a teacher who might be on planning during that time frame, and then would go in and cover a class, because teachers have that planning period during the day, and then those students would have someone covering the class for that time period. So principals have had to be very creative. We've actually had some principals who've gone in and taught the classes themselves, and did that so for a number of weeks, not even days, but weeks, in order to cover classrooms.
Thank you.
Are there other questions?
This
Mrs.
just
Boyer?
dawned on me. What do we do for subs during remote instruction? Like, if a teacher's, how does that work?
Dr. Wilson?
So we've had a varying examples. First off, we always want to look in the best interest of what's for the students, and that's the direction that Dr. Parker has shared, I have shared, Dr. Mills, is that let's look at the best interest for the students. If the teacher is on quarantine, maybe not having any symptoms and is able to teach, then that's what we want them to be able to do, because then they have their regular classroom teacher to do that. So, because some of our teachers, and again, part of one of the slides is it's not about the cases, it's about the contacts. So one case could take out 5, 6, 7 people. So if the teacher is able to teach remotely, because they're a contact, then we ask the teacher to do that. So that helps tremendously. We do have some situations to where the teacher has been a case and their symptoms would only last a few days, out of that, but they still are on quarantine, so they may teach up until that time to where they can't, and then they would start teaching closer to the end of that quarantine time after their symptoms. The other example is that the teachers on that grade level or in that content have band together and uploaded the lessons if needed so that the students could have asynchronous learning.
Okay, so do we don't hire a sub then for a remote learning?
We have had to do that, and we do have some who are willing to do that. Just like Dr. Parker shared that we have substitutes who have passed the course or who have completed the modules, we still have some substitutes that, while they've done that, don't feel comfortable in a remote setting. When we were in second quarter, I did visit some schools that we did have some substitutes who went in and did the face-to-face, and then, of course, they were doing the remote learning at the same time. But if a substitute is available and is willing to do the remote learning, then that we will do it. But we don't have as very many that are willing to do that. Most of them are retired teachers, and they've not had this platform, the remote learning platform.
Would you repeat that, Dr. Wilson, because that's going to be my question. How many hours of, this is Velma, how many hours of training do the subs have?
It's not in the number of hours for these modules. We have a total of 5 modules for them to go through to get some practice with an understanding of the learning management system and how to maneuver remote learning.
Okay.
And it may take some more times than others.
Okay.
We've had a lot of different scenarios in order to, whether it's the face-to-face or whether it's the full remote learning, to try to pull this together to make sure that, again, what we have shared with the principals, Mr. Linden, Ms. Lewis, and I have shared with the principals, is when you get to this point, and you have exhausted all of the measures within your building, you've used ESOP, you can't find a sub, then please contact us to where we can try to help figure out what's in the best interest of the students.
Other questions?
I've got one.
Mr. Borkin?
Mr. Parker, have we started trying to hire additional subs or maybe even done a job fair to try to bring some in?
We have not conducted any job fairs as of yet. Job fairs have changed nature, as you might know, in the last few months. They've gone from in-person to online in variety. We have, like I said, tried to make extensive contacts through the retired teacher network or just different people in the community. Our principals have been notified at just about every principals meeting about the number of subs who've completed the training, and have encouraged them to, contact local folks to try to come in and do the training so they can get on the list. So it is, to your point, it's one thing to build the pool of people, and then it's another issue to try to get that pool of people to report when requested.
All right, thank you.
Other questions? All right, Dr. Mills, you want to continue?
Sure. Dr. Williams is going to share some information about where we are with students and transportation as planned for next week.
Yes, sir. Currently in preparation for students' return to face-to-face. All of our high school routes will be completed by tomorrow. We're adding students at this time to transportation for those that are requesting transportation and did not complete a survey. So they're contacting the transportation department and being added to routes at this time. At the present moment, we have, these are the number of drivers that are needed that we do not have right now. Bedingfield needs 8 drivers, Fike would need 4 drivers, and Hunt would need 3 drivers. We are using all available drivers, and we currently have no substitute drivers. All the substitute drivers and licensed staff, they're going to be used to cover routes. Mr. Harvey is in the process with his team of working on those vacancies right now to get those filled. And any of those that, we have 2 factors. Number one, any of those that are not filled prior to returning face-to-face, they'll be utilized double loads to make sure that those students can get to school. And then the other piece would be leveling out those routes simply because we have a number based off of what we did for exams and what we have on survey data. But we do know that over the course of 10 days of running routes, that'll change and it'll level out. So so that's where we sit currently right now with transportation.
So about how many students does that impact?
For high schools and middle schools would be in Plan B, and they are only allowed 22 on the bus. So now we don't know how many students will actually ride once we go by and do the routes and pick them up, but that's how many you can be that can totally be on the bus is 22 in Plan B.
So have the routes been developed as they normally would have been? Okay.
Yes, ma'am. Yeah. Routes have normally been, at this time, we're just adding riders, has their contacted transportation. And transportation will have all those ready tomorrow morning.
Well, we started the year remote.
Yes, ma'am.
We went for a period of time in person, hybrid, but that did not include the high school students in the numbers.
That's correct. Yes, ma'am.
So we had a count that would normally be riding the buses, but we don't know how many will opt in at this point. Is that what you're saying? So that the need for drivers may not be as great as you're showing on your slide because of those that may not opt in?
Based on the routes that we have right now for students who ask for a bus during our exams, because we did transport students to high schools during exams.
Okay,
Utilizing that, along with those who have also contacted transportation that they wanted to ride a bus also, that's the number that we're basing it off of. I do have Mr. Harvey on the call who can just speak to that, to make sure that I am accurate in what I'm thinking.
Okay.
Mr. Harvey, is that correct in terms of how we built the routes and the number of drivers that we are short now?
Yes, sir, that is correct.
Okay.
We were basing the numbers are based off of like you said, the survey data that we received, in addition to people who called directly for bus assignments. So we did have some parents that didn't complete the survey that called transportation directly. We collected their information and we added them on routes as such.
because,
The shortages of the drivers came from drivers that just opted out due to safety concerns that they disclosed, myself or my department.
because if you built your numbers around those who had tests, your entire high school population did not have tests, those state mandated tests that they had to be in school for. And for those tests, many of those students' families took them to school. So is the number truly accurate for the consideration of a need for the drivers and the routes?
I left out the survey part, Madam Chair. There was the survey data that we took as far as those who wanted to ride a bus. I forgot to mention that part.
Okay.
Mr. Harvey, was able to bring that up. It was based on that as well. So, so based off of the surveys that were conducted of those who wanted to ride a bus and those that were contacting transportation to be added to the bus, in addition to those that we transported during the testing period, that would be the total number. So I did forget the survey data piece. But I would just ask Mr. Harvey, so Mr. Harvey, from what you have right now based off of the collection of data on drivers, this is what we know now based off of vacancies that have just now presented themselves moving into the face-to-face period of time. Is that correct?
Yes, sir. And just looking at the Bedingfield specifically, the most current number of transportation requests we have for them were around 497. And that is the school that we have where we have the largest driver shortage. Mm-hmm. And that's what impacted that. I hope I answered that question correctly.
Okay.
And so we looked at that number and we looked at the shortage, and I guess combined that with the fact that we can only allow 22 students per trip. That's what would necessitate the double loads.
What will be the consequence of double loads? How is the state holding us, or are they holding us to efficiency standards so that we get the reimbursement for mileage and whatever?
The guidance that I've received on that so far, Madam Chair, simply states that that's something is very fluid. They haven't really told us definitively how they're going to factor in efficiency, because this is a statewide issue. Because ideally, we would like to move the maximum amount of students with the fewest amount of buses, but no one is able to do that due to capacity restrictions. So in the interest of equity, they're not going to, well, allegedly, they said that they're not going to penalize us for that as of now, because there's no way that we can really be efficient during these times. Okay. Because with capacity restrictions, we can't move but 22 at a time. And some of our stops have 30 kids. So there's 2 separate trips for one stop. And it kind of creates a domino effect, because Bedingfield shares buses with Spate in addition to elementary schools. And if we're running double loads early in the morning, naturally, that's going to make everybody else late with the driver shortage.
Madam Chair?
Yes,
Ms.
Mr. Boykin.
Williams, as far as, our transportation, I'm getting a lot of feedback from the community that, they want to be back in school. And it's hit or miss in some spots, but the vast majority of what I've seen is, people want to be back in school and they want it face to face. If they're as adamant about, being face to face as they've expressed, is there any way that we can work with the community to get those numbers down as far as transportation?
As far as the number of folks wanting to ride?
People on the bus, if they're faced with the option of, I can bring my kid to school, or I can, keep them at the house because we don't have enough bus drivers. From what I'm seeing, it seems like a lot of people would just as soon bring their kids to school.
Yes, sir. Anyone who would choose to be a car rider, that's not an issue at all. I mean, they can just notify if they are currently on the bus, but choose to be a car rider instead, just notify the school, and school will take them off of the transportation form. I mean, they'll work with Mr. Harvey as far as taking them off the bus. In terms of being able to communicate something school system wide, that you have this option as opposed to riding the bus, I think that option has always existed. Being a car rider or being a bus rider, they've always had that option either way. And if they choose to move towards car ridership as opposed to bus ridership, then certainly all they need to do is let their school know, and then we can take them off if they're currently on a bus route right now.
Well, do you think that we should communicate that to our community, that the buses right now are limiting being able to get students into schools?
Yeah, I think what we would certainly communicate is those that are impacted by double routes, we would 100% have to communicate with those families and let those families know that we're impacted by double routes. As a result of that, this is when your bus would be coming either to drop your child off or to pick your child up. So we'd be able to communicate that. Certainly that option is available if there's something that the board would like for us to do as far as communicating with all of our parents that you have the option to ride as opposed to ride a bus, then I'll be glad to do that.
Well, I'm just saying that, the transportation to school is posing, in our brochure right here, that is an obstacle. And, I don't know that everybody in our community is aware of that.
Yes, sir. The main portion of that obstacle is the only having the ability under Plan B to have 22 students on the bus. If we were in a situation where that number wasn't limited and you can have as many riders on the bus as you would normally have for high school, middle school, then we wouldn't have those barriers to have to overcome. So, if there's anything that we need to communicate out in terms of we can only have 22 on the bus as a result of only having 22 on the bus, this is why we have double runs. We certainly would communicate that in here, and I'd be glad to get something put together to go out with Ms. Lynch if we need to do so.
All right, thank you.
Yes, sir.
Other questions or comments?
Madam Chair,
Mr. Mercer?
in all that I've heard, it appears that the risk to students seems to be so much less. It's a challenge to have enough substitutes. I understand there are many parents that would like for their child to be at school, but my major concern is making sure that we make the best of the time that we work hard to create by having the teachers available. And while a lot of the parents may find it easy to send their children to school, there's been quite a bit of apprehension on the part of the teachers. And understandably, because it appears that they are exposed to not just the children, but the families of the children, that because of their exposure at home and then coming to school. Ms. Ellen pointed out that far as the medical concern, it was more towards teachers' risk than it was the children's risk, although the children should be our focus, and I think it is by everyone. But to get the children to school by whatever means and not be able to have the right people there to serve them concerns me. I want them back as soon as they can be, but I also want them to go back at a time and in a manner that it can be sustained so that we will not be going in to schools and then having to stay out of schools and be remote back and forth. Because I think that's less productive than either of the two ways, and families having to make arrangements and then change their arrangements. I think we really need to be cautious and make sure we have teachers that are able to be there and enough substitutes willing to fill in as needed. Thank you, ma'am.
Thank you, sir. Other questions or comments before we move forward?
Madam Chair,
Mr. Boykin?
I would just like to say that, our competition, which is private schools and charter schools, are face-to-face. And, we're losing students to them. And I think that we need to figure out a way with all the budget that we have to try to get our kids back face to face. And we need to do it safely. And the main thing is I want to see an option there. I want to see the virtual as an option, and I want to see the face-to-face as an option. And that's just kind of where I'm at. Thank you.
You're welcome.
Madam Chair.
Mr. Mercer?
I don't disagree with Mr. Boykin. I like options too. But we have to realize that when we designate going to anything other than Plan C, the students have an option, but the teachers' options are almost zero. They're expected to be there. And we need to take all of it into account, and we do need to get everybody back. As to the charter schools, they're having problems too, but keep in mind their school is private and they keep their problems private. They're not in the newspaper the way that public schools are. And they've had to shut down classrooms and such as well. But again, it's about serving the students. We cannot serve the students without the teachers there. And we got to find some combination to get them back just as soon as we can safely. Thank you.
Thank you. Dr. Mills? You're muted, sir.
There we go. Madam Chair, that's a good segue to our last two slides, really, last couple slides. Because what Mr. Boykin was talking about, what Mr. Mercer was talking about are options. And, we're under the direction right now to, from the board's conversation last time, to start back Monday with students. Teachers came back today. And the other option you have is to look at something like we're offering today based on the data that we've seen before break, when we saw the closures and the classroom effects from contacts and cases. And now we're seeing a high number of contacts and cases even with students out of the building. I think during the board meeting last week, there were at least 5 cases that came in just during that time period. So one thing we've looked at is what are some things we could do to mitigate some of that and still get our students back again before the end of the year. So really, you're looking at a couple options. One is we can continue on what we're scheduled to do for next week, and teachers came back today, or we could look at a change in the return rate for teachers coming back March 15th, which is the end of the third grading period, and students would return on the 22nd. That's not a clean break with grading periods because the 15th teachers coming back when that grading period changes instead of students, but the early colleges are on spring break the week of March 8th. So it didn't make sense for us to consider coming back for one day and then everyone being on leave for that group of folks and students. So some of the things we've looked at doing if we were to delay into remote again is to continue to provide students an adaptive curriculum to attend school, and we can provide transportation, again, pending the availability of those drivers and folks, which we believe we can cover. Staff can still come to the buildings to do extended remote learning like they do now. We can still offer child nutrition services as we have done in the past. We can find opportunities for our bus drivers to work in various capacities within schools, and we can even continue the daycare centers at Bettyfield and Hunt. They're small numbers right now. So really the board's got a couple options. As y'all were discussing, some of the things you want to look at, it could be we continue on with our plan as it is. You've seen some of the pinch points with that, and there's pinch points with this. There's pinch points for families, there's pinch points for students, but it does address a lot of the concerns we've heard from our end, from principals and teachers, and even from parents. I think this is one of those situations where there is no easy or perfect answer. So we need the board to decide either we're going to continue on with what we've got planned now, which is, again, next week, students come back, or we consider some variation, and this is a variation we think would get us past some of the window that we've seen, like before break and now, and give us some time for the immunizations to start taking place and separations to take place as well.
Dr. Mills.
Yes, sir.
I'll be honest with you, I'm reluctant to ask teachers to go back face to face next week, but I'm also reluctant to think of waiting till March. If we're not going to go back next week, is there not a way that we could put our fingers on the pulse in 2 weeks, 3 weeks, something like that, so we can go back as soon as possible?
I think the question will be is what is the metric you want to use and what is the rate you want to use, and that is the difficult part because and everyone's looked at the studies and everyone's looked at the numbers and they're important, but the numbers vary and studies vary in cases. But again, the issue we've seen is a lot of times it's the contacts and not the cases. It's a variable number for us. Again, cases are important, but the contacts end up being the thing that affect our ability to operate schools. We can certainly look at an earlier date, and that's up to the board. We can work through the logistics of all these issues. We have since the beginning. The question is what the board would like to do with either a later start sometime before this, or do we want to continue for next week? That's what we need guidance on. And the reason why we're having the meeting today was to talk before students return. So if you want students to return next week, then teachers are there today and you can continue on, or we could look at a date sometime later in February. I think what you've got right now is you've got information from the health department that shows that our rate's very high. You've seen that being posted and discussed in the paper and other sources. But we've also got time to wait into February if you wanted to. I mean, we can make that work as well. There's no barriers to that. We're going to have the same pinch points then that we do now, which could be some drivers for buses. It could be availability of staff. I mean, it's going to be the same issue, just extended down to whenever date you look at. But the reason why we considered March 15th was it's a clear break on the calendar with grading and time, and it's a long break to let some of this bump that we've seen after the holiday break kind of settle down. We've seen that outside for Thanksgiving, which affected us right up to the last day before break, winter break, so that we could offer everything as we normally do all the way to this part.
Dr. Mills.
Yes, sir.
I understand, and I understand the logic, but another thought is since or just around Thanksgiving until Christmas, I went in each of the schools and I felt comfortable because of the protocols. But I'll be honest with you, I would be reluctant right now to want to go spend the day there with, and no disrespect to families or students, but with the chances of the contacts, as you put it, and in good conscience, I'm reluctant to feel like we should send the teachers back if I'm not comfortable going back and would be there all day. So personally, I think we need to wait. Now, how long, I don't know, and can't judge. And the idea of putting a date sooner than March would be a point to stop and to analyze it, would be more than saying we would go back at that point. But I do feel like we need to be aware, while the students aren't as much risk, but we really need teachers there. And we need our employees healthy enough to be able to continue. Thank you.
Dr. Mills, Dr.
ma'am.
Williams, Dr. Wilson, and Dr. Parker, I think that you all have done an outstanding job of continuing to put your finger on the pulse of what is occurring and making the recommendations to this board for action. We have always said in making these decisions that we would come back and renew and review, and that given the circumstance, if we needed to make other decisions, that we would. And so we are at that point now because we voted earlier that our students, that first our teachers would be returning today, and that our students would be returning on the planned hybrid options beginning on Monday. With the recommendations that you have provided to us, I think that we are being cautiously optimistic for the 15th of March to be able to return, to hope that the bounce in the uptick of numbers will see some time a drop with vaccinations now underway. But, you know, we still have to do 2 doses because both of the approved providers, Pfizer and Moderna, both require 2 vaccinations. Here in Wilson, we're just getting on the first in mass doses. I'm really looking forward to a revised schedule again that would allow our teachers and first essential workers to be able to get those shots so that maybe they can feel a little more comfortable in returning to us. We do know that the best place is face-to-face, but we have to be realistic about the need for remote. You have provided in your recommendations options for those students in the adaptive curriculum who we know need that continual face-to-face. You would be allowing the staff to continue to work from home, but give them the option of reporting to their buildings if they want to be in their classrooms. We know that every time we're out, hunger is an issue because it's ongoing, and you're providing options for students and families to still be able to get food provided. I think that the recommendations that you have made to this board are realistic in making sure that our students, staff, and the community are safe. And I think that that's what we are about here, in trying to make sure that the best is going on. I'm the first to say, yes, I agree that face-to-face is best. But if you don't have the teachers, I agree with Mr. Mercer. If you don't have the teachers who are comfortable in coming back, and each of you know that there have been emails that have been sent to us addressing the concern that teachers have in having that face-to-face contact again. And I would not like to see us lose outstanding teachers because we are going back into a face-to-face situation when they're not comfortable in coming back. I think that will increase the loss of our teachers. We don't have enough substitutes, and that's a problem that's being faced every day across this state and across this country. So I think we have to do what is best for everybody. Some will be happy with whatever decision we make. Some will not be happy with the decision that we make. But we have to work in the best interest of our students, our staff, and the community. So I'm going to open to ask you if there are any other questions about the recommendations that the administration is making to us, that we return on March the 15th with the students, that's for teachers, and with the students returning on March the 22nd, and with the others. So if you have any comments or questions or concerns at this point, we'd like to hear it before we move on, because we do have to take action in order to be able to see where we're going to go. So the floor is now open.
Madam Chair, I have 2 questions and a comment.
Mr. Breen?
The first question, I guess, would be directed towards Dr. Wilson in regards to the amount of people who have committed or signed the commitments for the virtual academy. Do we have an approximate number on how many of those have done that?
I do not have that, Mr. Breen. We had a lot of families who communicated to us that they would like it to remain open, the link to remain open until after the board meeting. And so I'm anticipating that after the board meeting's decision, then that number will change.
Yes, ma'am. Other than us not voting to do this, is there anything that would preclude us from bringing back elementary school kids under Plan B like we had originally done?
You mean Plan A?
Plan A.
The plan where they went 2 days, off 1, 2 days.
That was middle school.
No, I'm talking about elementary school where they went 2 days and then everybody had to go home on Wednesday. Then they came back Thursday and Friday for school.
Our elementary was served under Plan A, which meant that they went to school on Monday, Tuesday, Thursday, and Friday. And then on Wednesdays were asynchronous learning. And then at the middle school level, they were under Plan B, where it was under a blue group or a green group, and that was Monday and Tuesday, or Thursday and Friday. And then Wednesday.
I apologize for misspeaking, but is there anything procedurally that would prevent us from, like, as far as our board procedure, that would prevent us from bringing elementary school kids back under Plan A?
No, you're under that, right now, that's what we're, under the guidance to do from the board, which is Monday, we would start doing that. So no, sir, there's no. no issues to stop that. The only issues are the same ones we've been talking about all along, which would be an issue anytime, which is, availability of drivers, availability of teachers, and then issues we'd have to address with contacts or cases, same thing.
Yeah, and
Well, then these would be my comments. It seems like in reviewing the presentation that was given us today, the largest albatross seems to be how to deal with high school and getting the high school kids back. And speaking with high school families and teachers, it seems like the majority of them, some of which are working and have found jobs during this virtual learning thing that we've allowed them to do or given them to do or required them to do. Some of them seem to be doing well. I agree with Dr. Fitch and I agree with Mr. Mercer that ideally we'd have everybody face to face. But what I would ask and request the board to consider is bringing back not our most medically vulnerable population, but at least our most academically vulnerable populations, which are those K3 through 5 folks back under the plan that we were operating under. It would seem to me that we could at least service those kids under those plans, notwithstanding some of the classroom quarantining and some of the schools that had to shut down as we got closer to the break. It seemed to be going well. Just anecdotally, my son's grades from the first 9 weeks to the second 9 weeks, there's a 10-point swing in his grades. And that's the difference between remote learning and face-to-face. So sitting in my living room, sitting around the kitchen table right now, it's 11:40, it's time for lunch. It is case in point that, face-to-face obviously is better for those younger kids than the remote learning. In regards to the middle school the middle school teachers that I've talked to and discussed, those are some of the ones that have had to split classrooms. Those are some of the people, the majority of those parents have said, and the teachers have said that once they go the 2 days, their drive and desire to want to participate the 2 days they're remote goes almost to nil. But since this board has the ability to do this, and because we are in the business of educating children, and because it's not 100% safe, I agree to a point with what Mr. Mercer said about trying to make sure it's as safe as possible for our teachers. Even with the March rollout with vaccines, it's unlikely that we'd have teachers fully vaccinated, because we can't require them to do it until, the ones who do choose to be vaccinated until March or April. So I would request that on January 25th, we bring our pre-K 5 kids back in under Plan A, like they were going to during the second 9 weeks, and then revisit the subject in March.
Are you asking or making in your comments just that the pre-K 5 come back as planned
Yes, ma'am.
and leave the remainder on remote?
Yes, ma'am, until March, because it sounds like we've still got staffing issues at the high school in regards to bus drivers. And that'll give us time, hopefully, fingers crossed, to build up that substitute pool.
All right.
Madam Chair, I would agree with what Mr. Breen said.
Madam Chair, I would too.
I heard you, Mr. Boyette. Ms. Boyette, I've got you. I've heard you, Mr. Borkin. I'm hearing Mr. Mercer.
Am I recognized?
Yes, sir, you are.
Thank you. My preference would be to wait at least 2 to 3 additional weeks and bring back the primary grades, be it K3 or K5, and the exceptional children, because they also are in the group that are most needy for the face-to-face. But it would serve us well, I think, to wait an additional 2 or 3 weeks, excuse me, and make sure that we're coming back at a time that the numbers for quarantine because of testing positive or by contact or due to contact, and get a better reading on how that might affect us. Thank you, ma'am.
So you want to wait 2 to 3 weeks for the pre-K 5 as well as the exceptional children, and what do you want for middle and high?
I think we need to extend their time longer. I don't disagree with Mr. Breen on the idea that they can manage remote learning much better. And I think that our most needy students, as in regards to face-to-face, are the primary grades and exceptional.
So you want a wait period, an additional wait period of 2 to 3 weeks for everybody?
Yes, ma'am.
Okay.
Madam Chair,
Mrs. Powell?
I have a few comments. First, I do want to thank Dr. Mills and Dr. Wilson and Dr. Kim, Miss Ellen Manning, Dr. Parker, everyone that has given us the information that we received on this morning. The pandemic has made us all uncomfortable. It's heartbreaking to a lot of us because we've known people that have gone on from this. Community spread is putting our staff and our students at risk. I mean, this is something that we have to deal with. It's evidence right in front of our faces. And we've been dealing with this since March, but it was here even before that time. How can we teach our students, and how can we even instruct them without having our teachers in place? And then we're going in and out of quarantine, which makes it very difficult. I do understand how important it is to be face-to-face, because that's important. Face-to-face, one-on-one instruction works better than any other. I do not want to lose any of our teachers. I don't want to lose any of our students. I want them all back and all safe. And we know that Wilson County, which we try not to put so much emphasis on numbers, but we are one of the 10 counties in the red zone. We've had a lot of cases of COVID-19, and I think that, our assistant Wilson County manager, Ron Howard, he actually stated that virus we've been actually taking it seriously since March. We've been vigilant and we've been proactive. And Wilson County Schools has been vigilant and proactive. We clearly see that. And we've actually taken steps to try to make sure our students and staff are safe. There's no doubt about that, and we need to continue doing that. I feel this way. I don't want to put anyone in harm's way. I don't want to put our staff and our students in harm's way knowingly. That's intentionally. It's different if you go out there and you get hit by a car or something. That's different. You don't know that. That's not intentional. But intentional is when you purposely put somebody in a certain situation or space that may cause some type of harm or damage to them. Education is number one for us. We're educators. Wilson County Board of Education, we emphasize that immaculately, definitely, that we need education for our students. That's why we are here. As a board, we look at policies. We make sure that our schools are doing what they're supposed to be doing. Our teachers are teaching. That's very important. But how can we teach successfully if we have all of this in front of us, this danger that's in front of us? I mean, we're meeting remotely. I've met remotely since back in March. And one reason I have is because I have a mother who's elderly and I have to protect her. It's not so much about me, but it's just protecting her. I mean, I've actually had the COVID-19 test 3 different times because of situations I've been in. And we have to be protective and take care of our own. I realize that there are parents calling and we have emails of concerns, and My concern is that we do the right thing for our staff and for our students. We have to look at the lack of substitutes that we have available, the lack of bus drivers. We're splitting classes to try to make this happen. And I definitely give kudos to our teachers and staff for what they're doing, because this is not easy. I can't even imagine being in the classroom at a time as such as this, having to do all this. So I think we definitely need to take our hats off to them. As far as going back, I think that we need an additional 2 or 3 weeks to wait. I'm not ready to send them back at this point. I was so hoping that the vaccine would be readily available by now. I mean, it is, but to our educators, I wish we could fast forward that and move that a little bit faster. I mean, today we're doing the 65-year-olds and over at Fike High School, which I think is a great thing that we're doing. But also, I think that we should realize that thinking this, I realize there are some people that are not going to take the vaccine for whatever reason. But at least have it really available for our educators before we send them back into classrooms. Because I know I've had a question as far as the remote learning, teachers asking, can we actually do that at home because of the fear, even going out to the schools, remaining home and doing this. So I've had that question brought to my attention. But I would really prefer if we would wait the 2 to 3 weeks or a little bit longer to have more things in place instead of sending them back as of right now. I think it's a little too soon.
I think we've heard some comments from everybody other than Mrs. Barnes. Mrs. Barnes, are you going to weigh in on this?
Yes. I've sat quietly because I'm not afraid to say that I am recovering from COVID. And it is because of the contacts. And I'm really, really concerned, as safe as I've tried to be, as cautious as I have been, I worry about the contacts and the teachers who are more susceptible. Excuse me. And I know that we've had a small number of students who have, or small number of student to staff transfer, but I am concerned about the positivity rate in Wilson County being 12.9%. Face-to-face is one of the best ways for us to be educated. Anybody that knows me, when I taught school, I never hardly ever missed a day, even when I was sick. So I know the importance of having students there face-to-face. I know the importance of having healthy teachers there, but I really would opt to have us wait just for a little bit longer to make sure that we err on the side of safety. We know in March that the teachers will be able to start getting the vaccines, and that's very encouraging. I appreciate the work that everybody has done. I agree totally with both sides of the board that have already spoken, but I really would opt on the side of caution and give us a little bit longer to wait.
It does not seem that we have a straight consensus. We know that Mr. Breen, Mr. Bork, and Mrs. Boyette are wanting that face-to-face immediately. In the recommendations that the administration is making, there would still be the face-to-face for those who are under adaptive curriculum, to be back in the schools, as well as the daycare centers at Bedingfield and Hunt with limited numbers. It seems that Mr. Mercer, Ms. Powell, and Mrs. Barnes are wanting to wait 2 to 3 weeks. I'm willing to wait until the recommended time of March 15th and 22nd. So, in order to allow the administration to know exactly what is going to transpire, to allow our public to know what is going to transpire, we are seemingly at somewhat of an impasse, but not at the same time. So I'm going to turn it over to Mr. Mercer as vice chair for a moment, because I am wishing to make a motion, and I'll let Mr. Mercer do the carry-through if my motion receives a second. If not, then the motion will die, and it'll turn back to me anyway. So, Mr. Mercer, are you prepared for me to turn this over to you?
Yes, ma'am.
The members of the board, I move that we approve the recommendations as provided by the administration that you have before us, where the traditional and early college teachers return on March 15th and the students return on March 22nd, with all the subsequent issues to be resolved with the students in the adaptive curriculum, attending school with transportation provided pending the availability of staff. And everything is a pending, because if we don't have the teachers there, we can't do anything. That staff can report to the school buildings during this flexible time if they choose to, or they would have the option of being able to work remotely from home. That child nutrition provide the meals for students and families as they have done in the past. That bus drivers be provided the opportunity to work in various capacities within the schools, and that the daycares at Beddingfield and Hunt continue to operate with numbers limited as is currently in force. That, sir, is my motion.
Second.
Yeah, that's a whole lot of motion for me to, but if I understand it correctly, it's been moved properly moved by Dr. Fitch and seconded by, who seconded?
Mrs. Powell.
Ms. Powell.
Ms. Powell, that we accept the recommendation and remain in remote learning until March the 15th. Did I state that correctly?
Yes, March 15th for teachers and
March 15th, excuse me.
March 15th.
Is that correctly? Did I say that correctly?
March 15th for teachers and the 22nd for the students. Other than that,
Okay.
yes, sir, you said it correctly.
Okay. And let me say it again. It's been moved by Dr. Fitch and seconded by Ms. Powell that we remain in remote learning until March the 15th. Teachers will return and 22nd for students to return. Any further discussion or comments? Hearing none, please respond. Ms. Barnes?
Aye.
Mr. Boykin?
No.
Pardon me, was that a nay?
Correct.
Ms. Boyette?
Nay.
Mr. Breen?
No.
Ms. Powell?
Aye.
Dr. Fitch?
Aye.
And myself, aye. That means it passes 4 in favor and 3 opposed. Those opposing being Mr. Boykin, Ms. Boyette, and Mr. Breen for the motion. Now, Dr. Fitch, it's your meeting again.
All right, thank you. I know that an awful lot of work has gone into the process of preparing these recommendations, and we will be remaining on remote until the 15th of March for teachers and the 22nd of March for the students, with the other stated points being made that the adaptive curriculum students will be attending school beginning on the 20th, on this coming Monday, as was already scheduled. Staff will be able to report to their school if they choose, or to work remotely if necessary. And so, members of the board and the public, we thank you we will be vigilant and continue to keep track of what is going on with our numbers. So we will be revisiting as necessary for the rest of the semester. Is there anything else to come before us?
Madam Chair,
Mr. Mercer?
I think you just made mention of revisiting this just as we were planning to return to face, and we found the circumstances to be that we should have discussion and consider altering the plan. If there's a substantial change in a positive direction, I still believe that we should, if there's a substantial change, that we should revisit and look at it as possibly reconsidering when we go back.
Absolutely. I think it's a two-way street, and that if our numbers go down, we are very happy to come back and revisit this and see if we can put students back in face-to-face quicker than we have just voted to do. I thank the board for their attention and their diligence in looking at this and all matters that come before us. So thank you so very much for being with us today. Are there any other comments? Hearing none, the chair will entertain a motion for adjournment.
Madam Chair,
Mr. Mercer?
I move we adjourn.
A second.
It has been moved by Mr. Mercer, seconded by Mrs. Barnes, that we adjourn. Is there any discussion? Hearing none, please record your vote. Mrs. Barnes?
Aye.
Mr. Boykin?
Aye.
Mrs. Boyette?
Aye.
Mr. Breen? Mr. Mercer? Mrs. Powell?
Aye.
Myself, Dr. Fitch, aye. Let the record reflect that the motion carries unanimously. We are now adjourned. Thank you so very much.